Welcome to Fertilish, the podcast where we get real about fertility, infertility, and everything in between. I'm Laura.
And I'm Brandis. And whether you're knee-deep in treatments, just starting to ask questions, or somewhere in the ish of it all, you're in the right place.
Here we ditch the stigma, break down the science, and have candid conversations about the messy, emotional, and sometimes hilarious journey to growing a family and preserving your fertility.
So grab your coffee, your meds, or just your curiosity, and let's get into it.
Welcome back to another episode of Fertilish Podcast. Today we are discussing how to become an egg donor. At CNY, we have our own in-house egg donation program. And so we get a lot of questions about what are the qualifications of becoming an egg donor? What does that look like if I need to complete treatment myself, but I would like to donate some of my eggs as well? What kind of compensation is there? So today I think it'll be great to dive into all the nuances of becoming an egg donor.
Yeah, which I think, I've had a lot of questions from patients, friends about, can I be an egg donor? What are the stipulations? How much do you get paid? And we have a donor team that works with these patients to formulate a plan, and do all of that. And so I don't really see a lot of that side. So this has been a big learning thing for me, which is pretty cool. I think it'll be a really informational episode that we have learned from.
Yeah, absolutely. Our donor team is so, they're amazing. They are always so eager and available to answer questions and help guide all of because as you can imagine, there's so many different intricate nuances to not only becoming an egg donor, but helping, intended parents of either donor eggs, donor embryos, and the legalities of that and all the pieces of paperwork that need to be signed and consent forms and all the things. And so they do such a great job of navigating that entire process for everyone.
Yeah, and we've talked about, it's funny because I'm not the reality TV one, but when Love is Blind first came out, there was some girl telling the guy on the other side of the room that she was talking to, just up front, I was an egg donor in the past. And so, when they turn 18, they can, I may have a lot of people try and come find me. And she was telling him, this thing that she had done in the past. And I feel like it's just like with IVF and egg freezing, it's something that's becoming more talked about than it was before.
No, absolutely. And I think that so many people are freezing their eggs, just to have as a backup option, if they ever need or want to utilize that. And with that, more conversations are being had on social media, television, and it's a good thing. Obviously we want to circumvent the myths, but yeah, I think it's really great to, for more people to know that it's an option, and it can be accessible to so many more people.
Yeah, and so we do have guidelines to be an egg donor. Now, today we're just talking about egg donor, not necessarily sperm donors.
Right.
Because we, like Laura said, have our own in-house egg freezing program, but we don't for sperm, at least not right now. So today but you can be a sperm donor, just not with CNY. So Today will just be about becoming an egg donor.
Correct. That's right.
And then guidelines or there are kind of requirements that you have to fit into. Now, this is just for, I say anonymous donor, but it's not anonymous, and we'll get into that. But this is just for if you're going to be a donor for a family. Now, if you're picking a known donor, like let's say I wanted my sister or one of my friends to be an egg donor, they don't necessarily have to fit in these guidelines because I'm picking that donor, but this is for if you're just going to become a donor for our bank.
Correct. So if you are coming to CNY, you're clicking on become an egg donor, and you're filling out the application, and then we are going to be, featuring you on our donor profiles so that intended parents can choose from yours or someone else's on our in our egg donor bank from some of their profiles for eggs to donate or to receive. So yes, for the actual bank, these are the guidelines for that.
Yeah, so if you're listening and you're like, oh no, I was going to donate for my sister, or I
Yeah.
wanted my friend to donate and she doesn't fit within those guidelines, that's okay. It's a known donor. They don't need to.
But that's right. That's right. So some of the first qualifications are need to be healthy, need to be between the ages of 21 and 32, and then need to have a BMI of greater than 18 and less than 35. So, obviously, if you are 20 and wanting to become an egg donor, we would need you to wait until that 21st birthday. If you are 32 and going to have a birthday next month, you would not qualify because by the time that you went through the process of the application and then had an egg retrieval, you would be, you wouldn't fit within those parameters.
Yeah. And then we've talked about this in an episode before. You can't be a smoker.
Right.
I would assume that's for marijuana and cigarettes. No vaping.
That's right. Yeah.
And a non drug user. I want to say obviously, but we want the healthiest eggs we can get.
That's right.
And then, is this a new thing for eggs? The willing to be open ID in Colorado, or is it across the board now?
So since we are licensed in Colorado, and Colorado was the first state to pass the open ID laws, then we have assimilated throughout the company. So we just follow the whole, we follow what we would follow in Colorado. We follow it across the board for all of our locations. And that means that it doesn't mean that it's known. So it doesn't mean that we are giving your name and phone number out to the intended parents. But what it does mean is, so you will be anonymous to the intended parent. So they will not know who you are. But if there is a child that is created from your eggs after you've gone through the egg donation process and your eggs have been, purchased, for lack of a better word, by an intended parent, then they have been fertilized and those are, grow to become embryos, and then we transfer those to the intended parents, and then they achieve a healthy live birth from that embryo. Once that child turns 18, a donor-conceived person can request their donor's medical and identifying information. So it will not be given ever to the intended parent, except if that child gives the information to the intended parent. And then every 2 years after you donate, you'll be sent a message to update your medical and contact information, so that way we can keep accurate information on file, not only for just health information, but for contacting as well. And then your medical information updates will be accessible to any recipient that received your eggs. So they still won't know your individual information, like your contact information. Like they're not going to be able to, give you a call and email you or things like that, but they will know pertinent medical information that would be applicable to that donor conceived person.
Got it. So if you donate your eggs, if somebody is born from your eggs or using your eggs, once that person turns 18, they can get your information.
That's right.
As far as medical information.
Yeah, so I think that the medical information, it's my understanding that the medical information will be sent to the intended parents, along the way, but then the medical and contact information will be available to the donor conceived person at the age of 18.
Got it.
And afterwards.
Okay. Which is cool, yeah, because you'll kind of know a medical history.
Exactly. That and I think that's the really the main thing is that if you're a donor conceived person and you go on to need to complete information about your health history, there are pertinent facts that could be like pertinent information that could be applicable to your own health history.
Yeah, which is cool. And I also think, even if things were anonymous before, now with things like Ancestry, DNA, 23andMe, like people are finding their, biological, whoever they got eggs or sperm from. And actually, one of our nurses here so she has two moms and was conceived from IUI, intrauterine insemination. And this was when things were anonymous, so she didn't know the sperm donor, but she had done Ancestry because she was curious, and she had found like a bunch of siblings that lived in different places, and she's like, yeah, we call each other diblings, like donor siblings. She's like, and sometimes we meet up like once a year.
Oh, wow.
And like talk. So I mean, as far as anonymous goes, I feel like that went out the window kind of with those programs. But yeah, now you get medical information, so that's even better.
Well, and it's also like, it's also good to know the information to help prevent, I guess, conception with a potential relative. Like,
Yeah.
all of these things are tracked for good reason, so that way one day, you're not finding out that, there was some type of relationship, like biological relationship there.
Like you're not having a baby with your half brother.
That's right. Exactly. That's right.
Okay, so not only do you have to, be within these guidelines if you want to be part of the bank, and be willing to have open ID, but then you need to be willing to go through the IVF process.
And one thing I forgot to mention earlier was that you need to have an AMH of 1.5 or greater.
Okay. Yeah, an AMH is a measure of your ovarian reserve. So if you're in, ovarian failure, we're not going to put you through a cycle, or if you have a lower AMH, because we do want, potential parents to have the best, most amount of eggs we can get.
That's right.
So the IVF process, which, we've talked about before, does come with some preconception testing, which does, for donors, it is a physical exam, obviously transvaginal ultrasound, look at ovaries, and I think they do an antral follicle count, which is where, they're looking at the amount of follicles or those egg houses in each ovary, and then the blood work. And the blood work includes, for donors, a blood type, a complete blood count, a metabolic panel, so kind of like your normal physical blood work, an expanded genetic carrier screening. So we've talked about this before. So these donors are tested for about 700 different diseases. Chances are, likely they'll be a carrier for something. We just want to make sure that the egg donor is not the same carrier as something that the sperm is a carrier of.
That's right.
So, cystic fibrosis, you would have a 1 in 4 chance of having an affected child if the egg donor and the sperm are both carriers. So at that point, you may say, okay, we'll choose a different donor, or, we'll do genetic testing, PGTA and PGTM for monogenetic disorders to make sure that we don't transfer an embryo that's affected. So you get that opportunity. And then, so all of that takes about 2 to 3 weeks for that blood work to come back. I think they're also STI screened, so chlamydia, gonorrhea, HIV, syphilis. And then, if you pass all the tests and you are healthy enough, we put you through the process, which is about 2 weeks of injections that you do at home. So we want to grow all the eggs in your ovaries, and you're monitored. It's about 9 to 12 days of injections, probably 4 to 5 visits on average of ultrasound and blood work to make sure that you're responding to the medications appropriately. Once over 50% of the follicles in your ovary are mature size, you'll do a trigger shot, which matures the eggs. 35 to 36 hours later, you'll come back into the clinic for an egg retrieval. We've talked about this before. An egg retrieval is done with transvaginal ultrasound and a needle on the inside, so there's no incisions. It's done under anesthesia, so typically painless when you wake up. Sometimes it's maybe crampy, but not everyone has that. 5-10 minute procedure usually, and then you can go home the same day.
Yeah, and you're not intubated, so you're still breathing on your own during anesthesia. I get asked that quite a bit, because some people have some hesitations about anesthesia, but you're still able to breathe on your own. You do have an anesthesia provider, so an anesthesiologist, or CRNA. They're with you. That's providing care just for anesthesia, and then your medical provider is doing the retrieval for you, and then you have nurses that help, and you'll want to come with someone that day, so
Yeah.
someone will need to come with you to help kind of assist get you home, because you will be sleepy and groggy when you leave, and then you'll just rest the day of.
Yeah, and Laura and I have both had egg retrievals here. For me, it was like, and I have PCOS, so it was kind of, I was nervous going into it, but it was the best nap ever. I woke up and I feel like I didn't have any pain with mine really. Went to breakfast after. It was, it's not this big scary thing. I always used to see people post on Instagram pictures, and they're in, the surgical gowns and the hats and the thumbs up, and it's like, oh geez, these are big surgeries. And now that I'm like in it and have went through one, I'm like, oh, that's it. So it's not as much as you think it's going to be.
Yeah, I mean, I think that obviously, with any kind of procedure, there can be varying levels of hesitation, depending on that particular person. But yeah, I've been through 3 egg retrievals, and yeah, I mean, I think that the important thing is, stay hydrated. Go back to either your hotel room or home or wherever you are. Get some rest, and eat the snacks that you want to eat and watch the TV that you want to watch. So
yeah. For me, I think
that's my advice. My aftercare.
And I had bloating.
Yeah.
Probably actually, it was kind of like, it's weird because building up when I was taking the injections to like stimulate eggs to grow, I felt like I was getting a little bloated. After trigger shot, it like went away. I was like, oh, I hope I didn't like lose all these.
Yeah.
And then I went through the retrieval, and the bloating was actually worse for like 3 days after. And then by the time your period comes, for me, it was like gone. So, if a lot of people too ask about weight gain for a cycle, I didn't gain weight, but some people will gain like water weight because estrogen raises. Sometimes you can have third spacing of fluid, which just means that there's fluid in places it normally isn't and shouldn't be. But that all goes away. And then you should, go right back to normal.
Yeah, and there's some little tips and tricks, that like coconut water is a good thing to drink afterwards, and stay hydrated, and helps with, can help alleviate like some of the bloating. There's some, obviously eating, using a heating pad afterwards can kind of help with some of the symptoms afterwards. There's other little things that you can do, but ultimately I think just making sure that you wear comfy clothes to the day of your retrieval. Always recommend that.
There's nothing like trying to help you get back in your skinny jeans after with egg retrieval when you're groggy.
My second egg retrieval, I wore leggings, and my husband was like, "Why these leggings are so tight? Why did you do this? Why did you wear these? Like, why couldn't you just wear sweatpants?" And I guess I was a little groggy, and I was like, "I did," and he was like, "Laura, this is a sweatshirt. I'm talking about your pants."
That's so funny. Yeah, comfy big sweats.
That's right.
That's the best. Our nurses sometimes will help, because sometimes you are groggy. Will help you get dressed, and whenever people bring like tight stuff, they're like, "This is not going to be comfy for you. This is, it's." So yeah, baggy sweats are the best.
Well, ordinarily in my head, I guess I was thinking like, and I should have known this was my second egg retrieval. I was thinking like, on a weekend, an oversized hoodie and leggings, that's comfy.
Oh yeah.
But in this scenario, yes, no, you need like loose pants too. So sweatpants are better.
Yeah. So the process, is not as bad as you think. If that's kind of what's holding you back and you feel called to donate or you want to donate, doesn't really, interrupt didn't interrupt my life really at all. I would go to dinner and take shots in the bathroom or shots as in the injection shots from IVF.
Yes.
Not shots. And it was a lot easier than I thought.
Yeah, no. So I think that being willing to take a couple of shots each day for around let's say 10 to 14 days. So about 2 weeks. And then you need to live within 1 to 2 hours from either our Sarasota, Syracuse, Colorado, or Albany locations. And then, so our full service locations. Eventually we will recruit egg donors for our Norfolk location, but we're kind of not there yet. But that will be a place where we will want to, to get some egg donors for that location as well.
So live within 1 to 2 hours of the IVF locations, not
That's
like
right.
a monitoring site.
Exactly. That's right. And then be able to come into the office for 3 to 5 appointments during your actual donor cycle. So those monitoring appointments that Brandis was talking about, where we would do blood work and ultrasounds. And then, have an adult to drive and accompany you to the egg retrieval so that they're able to help you, assist you, going home with you. Obviously, we don't allow you to just get an Uber by yourself after you've been under anesthesia. So you need to have someone, over the age of 18 with you to accompany you and make sure that you get home safely.
Okay. And actually, if you are under the age of 32 and your AMH is over 1.5 and you're healthy and you don't smoke, this is the best time to also freeze your eggs.
That's right.
And we were just talking about a package we have where you can freeze your eggs and then donate the other half. Donate them. So your parts of this IVF cycle will be paid for. And do you want to speak to that a little bit?
Yeah, so this is commonly referred to as a split cycle. So if you are interested in freezing your eggs or undergoing IVF and you would like to donate your eggs to our egg donor bank, then you can do what's called a split cycle. So in this program, you would get so let's say you're wanting to freeze your eggs. So you would get your egg freezing procedure actually paid for. So you would be responsible for your medications and you would be responsible for your monitoring.
Okay.
But we will compensate or we will waive the fee for your actual egg freezing procedure. So you will get to keep 6 eggs from your egg freezing procedure. And then let's say you had 8 eggs retrieved, then 2 of those would be donor eggs. And then if you are interested in doing IVF with a split cycle, so same thing, you would get your actual IVF, waived. You still would be responsible for medications and monitoring, but the actual cost of the IVF would be waived, and you would get to keep eggs and then the remaining to become embryos, or to be, to try to become embryos. So they would be attempted to fertilize and grown to embryos, and then you would donate the remainder of the eggs. So the only caveat to this is that if you have less than 6 eggs retrieved, then you would be responsible for the cost of either your egg freezing or IVF, because obviously we wouldn't have anything to donate, any eggs to donate. So this is a really great way for people who are interested in egg freezing or interested in IVF, that, may fit these qualifications, but would like to, get these fees waived and do it in a more cost-effective, manner.
Okay. And then, so let's say, these patients are healthy, they fit all the criteria, they're ready to go through the process, all their blood work got or actually you wouldn't have started the blood work yet. So you fit the criteria, you're good to go through the process. If, you fit all these things and you're ready to become a donor, you actually can register on our website. At cnyfertility.com, and you click Become an Egg Donor. You fill out that initial application, which then goes to our donor team, which we've kind of talked about, email, and then they'll review it. And then if you are accepted, they will send you the next steps to kind of continue the process.
Yeah. So then after that, your application is going to include like medical history, family history, characteristics, and education. And some of this information will be uploaded to our like donor portal. People do not have access to our donor portal unless they are our patient. So I actually get this question quite frequently, and it is potential patients who are wanting to take a look at our donor portal, but they haven't become our patient yet. So in order to be able to view our donor portal, you do have to have like establish yourself as a CNY patient. So it's not like, which it's still anonymous. So even if anybody looking at it is not going to know it's you, but so it's not going to have your name or phone number or anything like that on the profile. But it will have, what color hair you have. Being a redhead, I have it just random times because there's so few of us in the world gone onto our donor portal to be like, let me see how many redheads we have, these days. But we will have like ethnicity, eye color. There's a lot of different information on the donor portal about each donor. And so intended parents can look at that and, kind of see what fits the characteristics of what they're looking for in a donor. And then it'll, show if they're available, if it's fresh, frozen, like it'll have all the nuances of information about like what they're available for. So if you have concerns about, any of your information just being out there for the world to see that you have been an egg donor, then, just wanted to ease those concerns that's not reality for sure. So, no one can see your name or your contact information except for us. Not even us. You and I can't see it. Our donor team. It is kept very confidential. And then even those characteristics that are seen by the intended parents are not able to be seen unless you're actually our patient and you're in the donor portal.
And I want to say, well, it's different. I think it is a little bit different for us because we were both patients, or we have been.
Right.
So we have a patient portal. And when I was going through this process, I was signing in through the portal to look at my cryo bill and all the things. Mm-hmm. And I had clicked on the egg donor portal because I was like, this is so cool. I've never seen this before, because we don't get it just as employees.
Yeah, that's a really good point. Like, we're only able to access that donor portal because we are patients, because it has to be a patient. So like everyone at CNY doesn't have access to that. Yeah.
Yeah. And at that time there were pictures, right? Are there still pictures, or no? Did that change?
They are. Mm-hmm.
Oh yeah.
Yep.
And that's so cool because you can see, what this person looks like,
as a baby,
what their education status is. So it just makes it a little bit more personal. Yeah. And like Laura said, you can, if you're thinking I want someone that looks like me, you have that opportunity because you're allowed to look through those pictures. So that's cool.
Yeah, absolutely. So, and let's say someone has a picture that they've uploaded of them, but they have blonde highlights. Like it'll say like what their, I guess, quote unquote, natural hair color is or whatever. So you may see that, it gives you kind of a bigger picture of like what, before the salon.
Yeah. Yes. And then, of course, if you donate your eggs, you get payment. Mm-hmm. So you don't pay for the cycle at all. We cover meds and everything. And then the payment is per cycle.
So if you're an egg donor without doing a split cycle, then that's exactly right. So we would take care of all of that for you, and then the compensation is $4,000. So we do have people who may be wanting to use, so that's another option, not a split cycle. So if they wanted to like do an egg donation cycle, get everything covered, and get the $4,000, they can then turn around and use that $4,000 towards their own
cycle.
That's right. And then, or you can do the split cycle, which we would waive either the egg freezing portion of your care or the IVF portion of your care. But if you are not doing your own egg freezing, or you're doing it in that manner, then you would get compensation of $4,000. And you're exactly right. So you would not cover, testing. You
Yeah.
wouldn't cover your medications, or your monitoring.
Yeah, so you're getting paid 4,000, and then there's a limit to how many cycles you can do, right? Donation cycles. I think there's like five. You can donate 5 times.
I was thinking it's 6, but
Okay.
yeah, I think it's 6. I could be wrong about that. Now
Okay.
I feel bad. That's
So
not
5
in my
to
notes.
6, maybe.
Yeah.
And so that's a significant amount of money, I guess you
Right.
can make if that's, you're trying to make money by doing it.
Yeah.
So yeah, there is a limit. You can't just do 20 cycles.
Right. That's right.
But yeah, I think it's a cool opportunity. We have a lot of known donors as well, but I think it's a pretty selfless thing as well to be able to give eggs to someone or a family that can't, either doesn't have their own eggs or doesn't have any more eggs or is in menopause or went through chemo. There's just so many reasons why somebody would need donor eggs, and I think it's just a cool process.
No, absolutely. I mean, to create an embryo, an egg is a very integral portion of that. So we have to have healthy eggs to be able to grow into an embryo and create a live birth.
Mm-hmm.
And you're exactly right. Like, we do have patients that, for a variety of different reasons, don't have access to that. So maybe their egg quality is not, is preventing them from being able to grow healthy embryos, or maybe they have diminished ovarian reserve. Maybe they have been through health complications that, like chemo, so that they've gone through oncology treatment, or radiation, or a variety of different things that has kind of led them to need egg donors. And it is an extremely selfless thing to be willing to donate, and a very much needed service for sure.
Yeah, and it's something to think about, if you feel called to do this. For me, we've had people or patients ask, oh, have you ever donated? Or you have eggs frozen, would you ever donate? It's such like I don't know, like something to think about. For me, I always say, like, I would feel like, well, that's like a part of me out there. I would want to know that person. So I would want to be like invited to every birthday party, because you'd feel so, for me, I would feel so like, I don't know, connected maybe, because that is my egg. But then you have like that, I was telling you earlier, my sister, who was like, I would do it. We'll go on a vacation after. And to her, that's not a thing. So something to think about. If you do fall within these ranges, it is a really, really special gift.
No, absolutely. And something that is so needed. I don't have any extra eggs to spare, but I really commend, we obviously, everybody that's watching this podcast probably knows that we've been going through our own fertility journey, and have contemplated at certain times, like, do we need an egg donor? And so I really, really commend, the selfless individuals who donate their eggs, to give the gift of, family, to the intended parents, because it is such an amazing and special gift to give.
Yeah, I agree. And so, yeah, hopefully if you've had questions, I know I get a lot of questions from people on my Instagram, and I don't work with this site a lot, because we do have our donor team, and Laura talks to some of them. So sometimes I'm like texting her, asking questions when people ask me questions. So now, I know a lot of these answers. So hopefully this was really informational for you. If this is something you're considering, or you're wanting to become an egg donor, hopefully this was helpful.
And if there's something that we didn't cover today that you have a question about, in regards to anything donor wise, please feel free to reach out to us. We have that form on cnyfertility.com/fertilish. It's a jot form. It can be completely anonymous, so you can submit that to us. We don't have to talk about it on the show. Like, if you want to just, get a response from Brandis or I, and if it's not something that we know the answer to, we will get in contact with the donor team and get that answer for you. Or you can DM us on Instagram. We have a lot of people that reach out that way as well. those come directly to Brandis and I.
Yeah.
Both of those avenues, and we'll be happy to get you answers to your questions.
Yeah, you can always do comment below the podcast. You can comment on Instagram. We have reels that we post all the time. Send us a message. And if you're a patient, you can send the donor team a message as well, I think,
That's right.
from your portal. So if you want to ask the donor team something, you don't even want it to come to us for whatever reason, that's fine too. You can send the donor team a message straight from your patient portal.
Absolutely.
All right. Well, I think that about wraps it up for this week. And we will see you guys next week.
Yes, see you next week.